Why do nurses monitor fluid intake for bladder support? Have you ever wondered why nurses keep such a close eye on fluid intake when it comes to bladder health? Let's explore this important practice. Nurses monitor fluid intake to ensure that patients stay properly hydrated. This is crucial for normal bladder function and helps prevent complications. When a person drinks enough fluids, it helps to dilute urine. This dilution reduces irritation to the bladder lining and lowers the risk of urinary tract infections, which can negatively impact bladder health. Keeping fluid intake balanced is essential. It supports regular urine production and helps flush out the urinary tract. This flushing action is important because it removes bacteria and waste products, reducing the risk of infections and inflammation that could harm the bladder. For patients who have bladder cancer or are at risk for it, managing fluid intake is particularly important. Dehydration can lead to concentrated urine, which may irritate the bladder lining and worsen symptoms or treatment side effects. Nurses track fluid intake for several key reasons. First, they want to ensure that patients drink enough fluids to prevent concentrated urine. Concentrated urine can irritate the bladder and increase the risk of infections. Second, they need to avoid excessive fluid intake, which can lead to bladder overdistension. This can cause increased urinary frequency and urgency, which might be uncomfortable or harmful for some patients. Additionally, nurses monitor for signs of dehydration or fluid overload. Both conditions can affect kidney function and indirectly impact bladder health. This careful monitoring also supports the management of symptoms related to bladder cancer or treatments like chemotherapy, which can change fluid balance or urinary patterns. In clinical settings, accurate fluid monitoring allows nurses to spot early signs of urinary retention, infection, or kidney impairment. These conditions are closely linked to bladder function. By being vigilant, nurses can guide timely interventions that protect bladder health and support recovery. In summary, nurses monitor fluid intake as a vital part of bladder support. This practice helps maintain hydration balance, promotes urinary tract health, prevents infections, and manages symptoms related to bladder conditions, including bladder cancer. Keeping an eye on fluid intake is a key aspect of ensuring overall urinary and bladder health.